Hello friends, today we are going to discuss about World Stroke Day. I am Dr. Suresh Padinmat, Professor of Psychiatry working at Nimans, Bangalore. Every year on 29th October, we observe this World Stroke Day. The reason to observe this day is to raise awareness among general public regarding stroke. This stroke can kill people and also cause severe disability among the person who is suffering from stroke. This stroke not only affect the person but also the whole family. The stroke can cause severe disability, my dear friends. Hence, we need to be aware of the early signs and symptoms of stroke. Knowing the signs of stroke is an important step to prevent stroke, my dear friends. Not only that, every person, every citizen has the power of saving lives. Hence, this year theme is #PreciousTime, World Stroke Day. I request all my friends, followers, subscribers, healthcare professionals to raise awareness among stroke in general public. Use this #PreciousTime, World Stroke Day in your social media. Please do this. We need to act immediately at this point of time. We need to raise general awareness about stroke in our public. Every minute counts. Actually, every second counts. Immediately when the stroke occurs, if you act very fast, if you are able to give treatment immediately, you can save lives, you can save brain, you can save neurons, save the person's memory, lives, becoming mobile, and that person can be functioning and the whole family survives going through a hardship, my dear friends. That means you have a power to save people. Let's understand what is stroke. Stroke means whenever there is a blood supply to the brain is interrupted or stopped. There are two important reasons. One is hemorrhagic stroke, another one is ischemic stroke. In hemorrhagic stroke, the blood vessels gets ruptured and the blood leaks into the brain. And this causes the blood supply to the brain is stopped. If there is a ischemic stroke, that means there is a emboli or a thrombosis is formed inside the artery and the whole blood supply to that brain region is stopped, my dear friends. In hemorrhagic stroke, either it is a thrombosis or emboli from the different part of the body comes and lodges in the brain. Whereas hemorrhagic is because of usually hypertension or invariably because of the aneurysm. But the commonest is ischemic stroke. For every 4 ischemic stroke, there is only 1 hemorrhagic stroke. That means the commonest is ischemic stroke, my dear friend. Since there is a blood supply to the brain is stopped, oxygen supply is stopped, and also glucose supply is stopped. Various nutrients which has to be supplied to the brain is stopped. Not only that, there are some metabolites which has to be removed from the brain. That is not occurring. And this causes death of neurons wherever the blood supply is stopped, my dear friends. Hence, we need to act fast. We have very little time. Hence, we need to identify the signs and symptoms of stroke, my dear friends. You can remember by this word FAST. F means facial weakness. A means arm weakness. S means speech difficulty. T means time to act now. F, facial weakness. A, arm weakness. S, speech difficulty. T means act now. Time to call ambulance. And also it is remembered by B, fast. B for balance, that is sudden loss of balance. E for sudden double vision or blurring of vision. F as facial weakness. A for arm weakness. S for slurring of speech. T for time to call now, my dear friends. The presentation of stroke depends upon where the blood supply to the brain is stopped. It can cause facial weakness, limb weakness, altered speech, confusion, coma, headache, gait disturbance. It depends upon where the stroke has occurred, my dear friends. I am repeating this because you remember this fast. Facial weakness, arm weakness, and slurring of speech. Time to call now, my dear friends. How common is this stroke? Let's understand the epidemiology of stroke. Across the world, it is the second commonest cause of death. third commonest cause of disability across the world, my dear friend. Every 1 in 4 is developing stroke, my dear friends. Every year, 12.2 million people are developing stroke and 6.5 million people are dying because of stroke. That means in any given cross-sectional time, there is 110 million people are suffering from stroke. And because of this, it causes severe disability among the person with stroke. Not only that, severe burden, both physical and mental burden on the family. Not only that, economic burden, and also the person is unable to move, passing urine and stool in the clothes, bedridden. The whole family has to go through a hardship, and they need to provide care to this person. During this time, the family requires money and also to provide care. And this causes an economic burden not only to the family, to the community and the nation at large. Let's understand what is the scenario in our India. In India, every year, approximately 18 lakh people are developing stroke. On an average, 145 to 150 people are developing stroke per lakh population per year, my dear friends. That means 4 to 5 people are developing stroke every minute. Approximately for every 20 seconds, there is one stroke occurring across India, my dear friend. In that, 40 to 50% are dying immediately for non-availability of treatment. Remaining 50 to 60% develop severe disability, my dear friend, if that timely treatment is not available. There was a study conducted by Suresh Kumar and his colleagues regarding the incidence of prevalence in India, which is published in Indian Journal of Medical Research, my dear friend. This study looked into the incidence and prevalence across India. This study clearly reported that cumulative incidence of stroke in India is 100 to 150 per lakh population every year. Prevalence is somewhere around 44 to 559 per lakh population, my dear friend. That means it is increasing slowly and it is becoming a public health problem, my dear friends. Unfortunate is this, case fatality rate is 45%. Studies clearly have said that for every 100 people who develop stroke, 45% of them dying within a period of 1 to 2 days. Let's understand what are the risk factors for stroke. The risk factors of strokes can be remembered by strokes happens. What does it mean? S means smoking, T means thinners. That means you have been prescribed blood thinners but you have stopped it. You are high possibility to develop stroke. Rhythm, that means your heart is not beating at the rhythm. Heart problem is there. If you are taking oral contraceptives, if there is a family history of stroke, excessive weight, if you are obese, you are high risk for stroke. Senior citizens, H for hypertension, please take treatment for hypertension. Atherosclerosis, physical inactivity, past history of transient ischemic attack, very oftenly called as minor stroke has occurred, elevated glucose, that is diabetes, aneurysm in the brain, stress and depression. These are the commonest risk factors which have been identified by various studies across the world, my dear friends. Let's understand how to prevent this stroke. First and the foremost is maintaining healthy lifestyle. Avoid smoke and alcohol, my dear friends. Regular physical activity is an important key factor you have to remember. Dietary modification, limiting sodium, meat and sweets, and also regular health checkups play a very important role in prevention of stroke. Let's understand the myths and facts of stroke. Myths are: people say stroke is unpreventable. No, stroke is preventable, my dear friends. Stroke cannot be treated. Sorry, stroke can be treated if it is identified early and treatment started early. Only it strikes elderly people. No, stroke can strike even the youngest person at the age of 6 or 7 have developed stroke, my dear friends. Recover happens only few days. No, recovery is lifelong, my dear friends. That means rehabilitation of stroke is very essential. What are the factors affecting the outcome of the stroke? Whether my family member will improve or not is dependent on 5 important factors. patient factors, comorbid condition factors, stroke-related factors, treatment-related factors, and social factors. Let's look into each one of them. Patient factor: what is the age, education level, intelligence, what is his personality, and his motivation to do rehabilitation. Now the conditions, medical condition: hypertension, diabetes, and heart disease if it is there. Stroke-related factors: stroke severity, type of stroke, location of stroke, size of stroke, coma at the onset, bladder and bowel incontinence. Treatment related: early identification and treatment, availability of neurorehabilitation, types of intervention done, timing of intervention and rehabilitation, intensity of therapy, endurance, and pre-stroke health also plays a very important role. The other important is social factors. What is the socio-economic status of the family? Is there any person who is looking after them? What is the financial status? Whether the family members are participating in the treatment? What is the emotional support of the family and the patient? Home environment plays an important role in rehabilitation of stroke, my dear friends. Let's understand what are the challenges in providing care for persons with stroke. First and the foremost is awareness about stroke. Every citizen in India should know about stroke. Access to treatment is the second important thing. Availability of treatment across time, 24/7. There should be availability of ambulance, availability of treatment, and the treatment should be affordable, at least free of cost for poor patients. Adequate beds, adequate doctors, and adequate number of emergency care is required. Quality of treatment: that means clear protocol should be available in every hospital. As soon as the patient comes, the attender who is in the hospital should know, yes, this is stroke. What is immediate action to be taken? What immediate next step is to be done by the nurse? And it should occur immediately. And also CT scan imaging, MRI should be available at the earliest. That means multi-speciality treatment facility should be available. And availability of ambulance, at the same time trained human resources with regard to stroke, imaging facilities, early treatment, medications such as for thrombolysis and also thrombectomy, stenting, stroke rehabilitation, activities of daily living rehabilitation to be done, early mobility of the person, well-controlled comorbidity like hypertension, diabetes, taking blood thinner, and access to these medications free of cost is essential. Telemedicine for follow-up and rehabilitation is very essential. Stroke patient cannot move. Hence, telemedicine should be leveraged by every doctor in this India. Home care is the norm. Community care should be the norm. Treating the patient in emergency in the hospital is the only thing. The next care should be done at home, my dear friends. Looking after them in the home and nursing home is a big challenge. Family members need to be trained. Home-based and community-based rehabilitation is the answer for stroke, my dear friends. So, rehabilitation with regard to mobility, rehabilitation towards speech, activities of daily living rehabilitation, occupational rehabilitation, behavioral rehabilitation, cognitive rehabilitation is the answer, my dear friend. And these to be delivered through telemedicine. You should not be calling patients every day for rehabilitation, my dear friends. It will become a burden on the family to carry the patient to the hospital for rehabilitation. Hence, training the caregivers to do rehabilitation at home is the answer. And we need to do the burnout management in caregivers, my dear friend. Hence, family therapy, involving all family members in providing care, removing guilt in the family members, financial support, and we need to pressurize the policymakers to provide access to care, my dear friends. To conclude, my dear friends, at this point of time, stroke is becoming a public health menace. That means it is rising like a COVID pandemic, my dear friends. Given the nature of disability, death due to stroke, we need to act very fast. We need to urge our politicians to invest in healthcare, invest in providing care for stroke people and also rehabilitation. Stroke is a silent epidemic. I'm repeating this, my dear friends. We need to plan for early identification by increasing awareness in general public, Early intervention in the hospital, in the PHC also should be done at the earliest, my dear friends. Immediate action is the answer. 24/7 stroke treatment should be ready in every hospital. Immediate imaging facility and also training all primary healthcare givers. That means doctors at the PHC, doctors at the district hospital and community health center should know about stroke and act immediately. And further thrombolysis and treatment should be available in each hospital, my dear friends. And also stroke rehabilitation. My dear friends, when it comes to stroke, every minute counts. Actually, every second counts, my dear friend. Hence, everybody should be aware of this stroke. And everyone stands benefit from better community awareness about stroke. Hence, I urge everyone to use this hashtag #PreciousTime, hashtag World Stroke Day, my dear friends. Thank you very much for giving your valuable time. Stay safe.